Hello class, my name is Madison Timmering and I'm looking forward to diving into the topic I chose for this project. Firstly, I titled this podcast, Do You Have Good Taste? Due to the nature of what I will be discussing. In this podcast, I will be explaining the condition of ageusia following a COVID-19 diagnosis in adults. According to the National Library of Public Medicine, ageusia is characterized by a complete loss of sense of taste on the tongue. Furthermore, they explain that the typical conditions that cause ageusia include nerve damage to the tongue, diabetes, and anemia as examples. However, it is further explained that there have been cases of ageusia caused by an infection affecting the tongue's ability to taste, which highlights the possibility of the COVID-19 virus causing the development of this condition. Ageusia following a COVID-19 diagnosis has become increasingly prevalent in adults. Due to the prevalence of ageusia following the diagnosis of COVID-19 in adults, researchers have been called to conduct studies to further investigate the issue. For example, a study was conducted to track the amount of coronavirus patients affected by this disorder, in addition to following the recovery duration and rates associated with their condition. Researchers found that 85% of patients reported having the loss of taste while infected with COVID-19. Furthermore, they found that 7.2% of patients with severe cases of ageusia reported the perseverance of these symptoms after 60 days of onset of their COVID-19 positive test result. Clearly, ageusia following the contraction of coronavirus has become increasingly common and highlights the need for further research to be conducted. A study conducted at Barnard College highlights the importance of addressing this condition. In this article, researchers explain that this disorder can be prominent, sometimes persisting 8 months to a year after a positive coronavirus test result. They discuss the importance for further research to be conducted for the treatment of ageusia due to its potential chronic nature, greatly affecting the everyday lives of an increasing number of adult COVID-19 patients. Furthermore, in addition to the potential of becoming chronic, they note that the number of reported cases of ageusia in adult coronavirus patients has been gradually increasing since the beginning of the pandemic. There are multiple methods of treatment that have been suggested by researchers and physicians to address ageusia following a COVID-19 diagnosis in adult patients. Firstly, a medication called cerebrolysin has been suggested for the treatment of ageusia and has been shown to reduce symptoms of the disorder, in addition to promoting the quick recovery of the tongue's ability to taste. Although this medication can be effective for some, others may want to take a more homeopathic route to healing after losing their sense of taste instead of taking a drug. Luckily, there is an alternative treatment that has been suggested by physicians. Turmeric has been shown to aid in the recovery of the loss of taste potentially caused by COVID-19. This is promising to coronavirus patients suffering from ageusia because turmeric is readily available by most, while there may be some challenges gaining access to medications like cerebrolysin. To prevent contracting ageusia from the coronavirus, individuals must protect themselves from contracting COVID-19 in the first place. This includes washing hands frequently, wearing a mask when being in a public place, and avoiding individuals who are positive for COVID-19. If one does contract the virus, it is important to address treatment with a physician. If ageusia is observed by patients, they must contact their physician for additional support and treatment options that may be available. Clearly, ageusia has become a prevailing condition following the diagnosis of COVID-19 in adult patients. Luckily, continued research points toward developing improvements in treatment options in addition to increased awareness that this condition requires more attention. The treatment of ageusia is incredibly important, as it can negatively affect the everyday lives of patients around the world. Food has been used by countless cultures as a way to connect with friends and family, in addition to showing affection towards loved ones. If you can imagine what it would be like to lose the ability of taste following COVID-19, you would agree. This condition requires more research to be conducted to find a cure for suffering patients everywhere. Thanks for listening, and goodbye for now.